Hmm.
Our next lecture has three goals. First, you will apply techniques to assist patients from different cultures and patients with physical disabilities. That means giving care without judging or stereotyping, getting a trained interpreter when there is a language barrier, and helping patients with disabilities with transfers and tasks they cannot do themselves. Second, you will be able to list the components of a general physical exam, the head to toe areas and body systems the provider evaluates. Third and finally, you will describe the follow up steps you can take after the exam, such as scheduling visits, helping plan home care, and providing patient education within your scope of practice. Your role is to make the visit respectful, safe, and smooth for every patient who walks through the door. Here are the lecture's three outcomes. The first is a skill set. Apply techniques to assist patients from different cultures and patients with physical disabilities. You will learn to communicate respectfully across cultures, use interpreters, and help patients with disabilities safely. The second is knowledge. List the components of a general physical exam, which are the head to toe areas and systems the provider checks. The third is a process. Describe the follow up steps after the exam, including scheduling visits, planning home care, and teaching the patient within your scope of practice. Notice how these connect to the whole visit. You greet and prepare the patient with sensitivity, you support the provider through each component of the exam, and then you help the patient with the next steps before they leave. Our first outcome starts with culture. The single most important idea is to treat every patient as an individual and avoid judging or stereotyping based on culture. Culture shapes how people view health, illness, eye contact, personal space, touch, and family roles, but no two people from the same background are identical, so never assume. Respect those differences and stay aware of your own assumptions and body language because patients read your tone and expressions quickly. Keep your manner non judgmental and professional at all times. When you are unsure about a preference, simply ask the patient rather than guessing. This is the heart of culturally and linguistically appropriate care, often called CLAS, care that is respectful of and responsive to each patient's cultural needs. When patients feel respected, they share more, cooperate more, and get better care. When a patient has limited English proficiency or any other communication needs, such as deafness, obtain a trained medical interpreter so communication is accurate. National standards say language assistance should be offered at no cost to the patient. It is important to avoid using family members, friends, or minors as interpreters. They may not know medical terms, they may filter or soften information, and using them can violate the patient's privacy. A child should never be asked to interpret sensitive health information for a parent. When you work with an interpreter, speak directly to the patient, not the interpreter. Use short sentences and pause to let the interpreter relay your words. Look at the patient as you speak. Finally, document in the record that an interpreter was used and which language. Good interpretation prevents errors and helps the patient give informed consent and follow instructions. Now we turn to patients with physical disabilities. The guiding rule is simple: ask before you help. Do not assume a patient needs assistance or grab a wheelchair without permission. Let the patient tell you what they can and can't do, and respect their independence by assisting only with the tasks they genuinely cannot accomplish themselves. Keep mobility aids such as canes, walkers, or wheelchairs within the patient's reach at all times because taking them away leaves the patient stranded. Communicate at eye level, especially with a patient who uses a wheelchair, and adapt to vision, hearing, or speech needs by facing the patient, speaking clearly, and using written or visual aids when helpful. Finally, allow extra time and arrange the room so there is clear, safe access. Dignity and independence matter just as much as physical help. Helping a patient move from a wheelchair to the exam table is a transfer, and doing it safely protects both the patient and you. Start with good body mechanics. Place your feet apart for a wider base. Bend your knees, keep your back straight, and lift with your legs rather than your back. Use a gait belt for a secure hold and use assistive or mechanical lifting devices whenever they are available because national safety agencies recommend them to prevent injuries. Always lock the wheelchair and the exam table wheels before you begin so nothing rolls. Tell the patient the plan in plain words and count together. For example, on three, so you move as a team. And know your limits. For a patient who is heavy or fully dependent, get a second person or use a lift. Never risk a fall to save time. A single bad transfer can injure the patient or end your career, so do it right every time. The next part of our lecture is to list the components of a general physical exam. The provider works in an organized head to toe pattern, and your job is to know these areas so you can prepare the room, hand off instruments, and anticipate what comes next. We'll start at the top. General appearance is the provider's overall impression of the patient's health, posture, hygiene, and any distress, and it begins the moment they see the patient. The head is examined for the scalp, skull, face, and symmetry. The neck is checked for lymph nodes, the thyroid, and range of motion. The eyes are examined for vision and pupil response, often with an ophthalmoscope. The ears are checked for hearing and the ear canal, often with an otoscope. The nose and sinuses are assessed for the airway, drainage, and tenderness. And the mouth and throat are examined for the teeth, gums, tongue, and pharynx. That covers the head and the sensory areas. Next slide, we move down the body. Continuing down the body, the chest and lungs are examined for breathing effort and breath sounds. The heart is checked for rate, rhythm, and heart sounds. The breasts are examined for lumps, symmetry, and skin changes. The abdomen is assessed for the organs, tenderness, and bowel sounds. The genitalia are examined for the reproductive and urinary structures. The rectum is checked with a rectal exam, which in males also assesses the prostate. The musculoskeletal system is evaluated for the joints, muscles, and range of motion. And the neurologic exam is checked for reflexes, strength, coordination, and mental status. Put the two slides together and you have the full list of components from general appearance at the top to the neurologic system. You do not perform these exams, but knowing the components lets you set up the right equipment, position and drape the patient correctly, and keep the visit moving smoothly for the provider. Our third and final outcome is the follow up after the exam, which is where you help the patient turn the visit into action. First, schedule future visits and any recommended screenings, such as the next annual physical or a repeat blood pressure check. Second, schedule visits outside the office when the provider orders them, including laboratory work, imaging such as x rays, and referrals to specialists. Third, help the patient plan for home care, which may mean arranging equipment, home health services, or support at home. Fourth, provide patient education about the condition, but only within your scope of practice. You can reinforce and explain what the provider ordered, review handouts, and answer basic questions, but you do not diagnose or go beyond what you are trained and authorized to teach. Finally, before the patient leaves, confirm they understand the plan and the next steps. Clear follow up helps patients stay healthy and keeps the care connected after they walk out the door. To summarize this lecture, we'll start on the left. When assisting patients, respect each person's culture and never stereotype. Use a trained interpreter when there is a language barrier, and help patients with disabilities and transfers safely while protecting their independence. In the middle, the components of the general physical exam run head to toe, from general appearance through the head, neck, eyes, ears, nose, and mouth, then down through the chest, heart, abdomen, and the musculoskeletal and neurologic systems. On the right, the follow-up steps are to schedule visits and screenings, arrange outside visits and home care, and educate the patient within your scope of practice. Put simply, respectful and safe assistance plus a complete head to toe exam plus clear follow up equals complete patient care. That is your role from the moment the patient arrives to the moment they leave. These references will provide information to you if you're interested in learning more about this topic.